some people are thinking that the results that we are showing, the eugenics hair transplant results, they are results of medication and not of the procedure per se. So I would like to counter that. The fact that eugenics emphasizes on medication is very important to stop the progression of baldness and to make sure that the patient doesn't need transplants again and again in future. So keeping that philosophy in mind and considering the safety factor of the medications much in favor of the benefits than the risk of side effects, we are advising rightly as per the medical guidance to take the medications, and it is all the more relevant in young patients. Now when we are showing our results, we are being very transparent, and you can make out from the way we portray our results. I have selected 2 cases to tell you what exactly is the philosophy with which we evaluate a patient's baldness at eugenics. How we evaluate and how we manage, which might be different from other people or other doctors who are doing the procedure. So like in this patient, he has baldness in the mid-scalp and the crown area. Frontal zone and the hairline zone is retained. We haven't implanted unnecessary anything over that area because it is full of dense hair. And we have done implantation with optimum density, I would say optimum density, not a high density, in the mid-scalp and crown. So we have been able to achieve good coverage. Now when we are doing the density, we have to make sure that we retain the pre-existing hair. We will not put lot of grafts to give a very high density, because when a patient is ready to take medication, he will be able to retain the pre-existing hair also. The philosophy is to do the maximum work with minimum number of grafts. Similarly, in this patient, his case was a bit different. He already had one procedure done in the past with not so great results. Because he hadn't taken medications, we did a surgery in the hairline zone, because if you see, the hairline has sparse hair and those are transplanted hair. So this area is unlikely to improve with medication. So that's why we demarcated this zone and did a transplant in the frontal zone. In the mid scalp, he had a lot of pre-existing hair. Okay, so we didn't do the transplant in the mid scalp zone, and again we did the transplant in the crown zone. So you can see the difference that he has a good population of dense hair in the front and dense hair in the upper part of the crown, whereas mid scalp is empty. Now this is a risk we have taken. Why? Because some people, they respond excellently to medication. Had he responded excellently, he would have needed a transplant here. But because those hair haven't improved with medication, now it's safe and a wise decision to do a transplant in that zone also. Secondly, let us suppose the other scenario. We are not giving this area to improve with medication and we do a transplant straightforward. Again, we will not be able to cover the crown in that case. So the overall harvest capacity of the patient gets exhausted if we start implanting in the pre-existing hair zones, which are more likely to improve with medication in future. So a wise doctor will always advise you to be conservative, to first try the medications in areas where you have pre-existing hair and the chances of recovery are very high, like crown and mid-scalp, all those areas. And if they haven't improved, then yes, it is good and a wise decision to do a transplant over there. So when we are showing our results, we are clearly demarcating the area which we are doing and the area which we are not doing. And we have been very transparent in telling those things to patients.
And that is why the graft estimate that we are doing at eugenics is much lesser than some of the other clinics for the same grade of baldness.